guest is Dr. Stephen Brodsky, who is in private psychotherapy practice in New York City. He treats people with all kinds of anxiety issues, including fears of marrying. In fact, he says that many of his patients who might otherwise end their relationship can be helped to manage their fears in a way that does not cause the relationship to end. This topic certainly is timely in light of this being the season for weddings. Welcome to the program, Dr. Brodsky.
Dr. Beth, it's a pleasure to be here.
Oh, good. So now that I've done my show and tell us one of your success stories so that people can see from another angle that it is possible to manage their extreme anxieties about marriage.
Well, there's sort of a difference between what people consider to be, normal nervousness and cold feet versus something that is really born out of a more serious anxiety disorder, which, may have been present or some other strong issue obviously present in the case that you just outlined so well. And I'm so happy that it did have such a happy ending.
Yeah, me too.
I can describe another case that went through much struggle. This was a young man who came to me, seeing a girl for a number of years, getting closer and serious, and would pretty much break up every week and then reunite, just a couple days later.
Oh.
So, when I began working with him, it was obvious that, first of all, he had a history of OCD, and that what he was acting out on
What's OCD,
was itself.
Dr. Brodsky?
OCD stands for obsessive compulsive disorder.
Uh-huh.
It's an anxiety disorder in which people, a lot of people have maybe seen certain types in movies, like washing or checking.
Mm-hmm.
But there are actually millions of different types of OCD. One of them is where someone begins to worry, do I love this person, or does this person love me?
Mm-hmm.
And in order to calm themselves, they engage in what we call compulsion. They engage in some way, either they run away, or they try to rationalize in their mind why the person either is or is not right for them.
Mm-hmm.
And that's in spite of the fact that they actually have a very good relationship.
Mm-hmm.
So this young man, we worked together for a while. He was very overwhelmed in the beginning, and but gradually through therapy, he was able to overcome this and had an incredibly long-suffering and patient girlfriend. Yeah, and eventually they did indeed become engaged, married. They invited me to the wedding, and now have a family of with two nice sons.
I love happy endings, don't you?
Certainly do. Yeah, it certainly is what we look for when we're trying to get someone, to move on with their life.
Yes, exactly. So how does the average bear listener determine, is this just normal anxiety that everyone goes through, or am I about ready to walk down the aisle with someone who's the wrong person for me?
Mm-hmm. Well, I think that if both of you feel that it is, relatively sure and had been sure up until, for a while, up until a certain, recent point, that it was meant to be, and then suddenly you find yourself doing behaviors that even you consider to be unexplainable or unreasonable, such as breaking up and reuniting and so forth, then that would be the sign of a serious anxiety disorder, but one that's extremely treatable. So that would be one type of anxiety.
Mm-hmm.
If it really was something like this really is not meant to be, I think some people, there are certain combinations of couples that sometimes come together. One is where one spouse is very, very, very nice person. Everybody sees them that way, very patient, and very not the most outspoken. The other party is acting out in some way, is could be doing things that are uncaring, selfish, etc. And obviously one sort of preys on the other.
Yeah.
And so I would say that if you found that you began to speak up about whatever the other person was doing, and if they were able to respond in the way that you wanted, then that's probably a workable relationship.
Mm-hmm.
If, however, you keep speaking up, they keep doing the same thing, then that really is perhaps an opportunity either to go to a couples therapist or, in some cases, to decide to end the relationship.
Right. Yeah. That's probably one of the hardest decisions people have to make, is whether to proceed or not. Because I know divorce court is riddled with people who overrode all their internal circuit breakers that said, be careful, this guy or this gal is just a nutcase, or to speak colloquially. How do you sort and sift that out? It's the hardest thing to do, I think.
Well, it's certainly beyond the scope of just this interview, but it's something that people have been doing for thousands of years. Certainly, being able to sort out the right one for me and the one who's not.
You just told us the story of the person who had a fairly extreme case, it seems like, of obsessive compulsive disorder, or OCD. But his girlfriend hung in with him. But I bet she had tons of conversations with her girlfriend saying, dump this guy, he's a loser. And so it's difficult to sort out other people's reactions too. Are they seeing the real deal or not?
I think that is true. People are very confused about OCD, what it is, what they're looking at, whether this is indeed someone who just doesn't love, in this case, this woman, or whether he does, but there's something that they can't explain that's preventing it from happening.
Yeah.
I think that there is lots of, OCD, moreover, doesn't just affect the person who has it, but certainly other people, whether
everybody,
family or,
mm-hmm.
and so forth. And if they really don't know what's going on, it really can just deteriorates from there.
Yes, exactly. And so, from my experience with the case that I outlined at the beginning of this segment, when people could have an aha experience, oh, that's why I'm doing what I'm doing, and realize it has nothing to do with the partner or the viability of the relationship, it begins to suggest a clear path. How long did it take you, if you can recall, to help this young man realize that it wasn't about her, and that it would be, and to understand why it was, and that it would be safe to proceed?
Well, I think that it actually did not take very long for him to realize what this was. And in fact, that is actually the hallmark of OCD, is that the person themselves, at least sometimes, knows that what they're doing is, or what they're worried about, is not true. What they're thinking about is false, and what they're doing doesn't make any sense. But they can't stop themselves anyway. They, like I say, they don't call it compulsive for nothing.
Yeah.
The poor person really feels almost forced against their own will.
Yeah.
Even if a person realizes that the relationship is good, but they just can't suffer like this anymore. And their answer to not suffering is to break up.
Yeah.
Because the suffering just overwhelms any kind of clear thinking.
Yeah. And the suffering is tremendously painful.
Yes, it is. It would be less painful if I had delusions, if I really believed something that wasn't true. I would be less bothered by that than having thoughts, engaging in behaviors that I know are not true, but that I can't stop anyway.
Wow. So this is going to be a real basic, almost dumb question, but what is it that fuels people's compulsions like this? I mean, anxiety, yes, but why are they so anxious?
Well, I think that like most things in life, particularly mental health, there's a little bit of nature and a little bit of nurture. Oftentimes, people with OCD can find someone else, either in their family or extended family, who may have had a similar type of condition, maybe in a slightly different way. But what really makes it really get perpetuated by a person and become worse and worse is that the very thing the person's doing to try to cope with the problem is actually the cause of the problem. Trying to reassure myself, this young woman is the right one for me, well, the more I keep saying that, the more I'm actually reminding myself of my worry all the more. So it doesn't bring closure, it actually makes me worry more, and it just becomes a vicious cycle.
Yeah.
So another way that you could see that this is happening with a person is, if you're dating a person, for example, is if they require repetitive reassurance about the relationship, that usually is a very good sign that they may have OCD.
Okay. But what if people come by the need for reassurance that others might think is over-the-top need, honestly, like the early death of a parent, for instance, or a parent's divorce? I don't know that I'd call that OCD. I think I might just call it an intrapsychic issue left over from the death of a parent or a parent's divorce.
Absolutely. That would reassurance is needed by everybody, and for most situations in life, reassurance actually works and brings some closure, at least in time. The difference is when it doesn't bring closure and when you appear to be getting actually worse over time.
Yeah, okay.
That would be a good distinction.
This is Dr. Beth Erickson, host of Relationships 101 on webtalkradio.net. Right now I'm speaking with Dr. Stephen Brodsky, who specializes in the treatment of people with anxiety. And in fact, he has a website that contains a treasure trove of information. It's called OCDHotline.com. OCDHotline.com. I was reminded as I was preparing for this conversation, Dr. Brodsky, I'm sure you are familiar with the work, the 30-year follow-up study of Judith Wallerstein, who started following kids in their elementary school years whose parents came divorced, and she looked at how that impacted kids. And she came up with, I think, a very apt description, the sleeper effect, where people go along without any apparent problems until they're in their 20s and they begin to contemplate a permanent relationship, such as a marriage. And then the residue of the parents' divorce rears its ugly head and becomes virtually incapacitating. So they don't know how to manage that. If you looked at the patients you work with from that frame, would that adequately describe your folks? Or is it that too, plus their generalized anxiety disorder?
Well, I think that I think that study really does describe very eloquently, as does your summary, how these issues come up, whether it takes the form of OCD or other insecurities about relationships. We have certain beliefs about relationships that we learn from the relationships we see as children, usually from our mother and father. If it's a negative one, we tend to take away from that certain negative beliefs about how our relationships will turn out.
Yes.
Now, that often can factor in and contribute to the person's OCD, so that at that time in their life, their OCD takes that form. But frequently, people's OCD may have started in a different form, when they were really young children.
Like fear of snakes or spiders.
Exactly.
Like that?
Well, as a child, children frequently, will wash more or ask questions more, things like that. But coming back, to your question about the study, yes, I think that definitely does factor into it.
Yeah. It is very hard. I have a 23-year-old who is trying to assess whether he wants to stay in a relationship or not. And there are a ton of legitimate questions he has, no doubt. But the fact of his parents' divorce when he was pre-adolescent certainly contributes to his worry about, am I making the right choice?
That makes perfect sense. I think it goes further, though, Dr. Beth, that
Tell me.
It's not just that people are afraid their marriage will also end. It's that their whole conception of what a relationship is and what it's about and what it's supposed to be for is very confused. So even their choice as to who is the right person for me, how do I make that choice?
Right. And how do I make that choice when I have not had a role model for a healthy, lasting marriage?
That's right. But I would add that obviously, it's not a sentence. If you have divorced parents, will have to come up, with lots of anxiety and obviously it's a matter of how it's handled, between the parents and how much they're able to minimize the disruption and pay attention to what the children are themselves going through. Yeah,
which clearly that a very important factor in both parents and child's post-divorce adjustment. But alas, in my experience, too many parents are preoccupied with themselves and their own anxieties and needs to pay a reasonable amount of attention to their children's needs.
That is often the case, and the children don't know how to express themselves either.
Right, exactly, because they don't have the words, let alone the concepts for what's going on. For instance, one of the examples that Wallerstein uses in the first study she does is when a little girl who's, 5 or 6, for the first time goes to her dad's apartment. The only way she knows how to express her anxiety for him, and is he going to be all right, is to go to the refrigerator, and when she finds no orange juice there, she's very distressed about that. Well, that's how kids telegraph their concerns, their worries.
Yeah, that's true. I mean, that's why it's important when adults are viewing children, both teachers as well as parents, to notice any changes in behavior. It really doesn't matter what the change is, but just a sudden change in any kind of behavior, appetite, friendships, behavior in class, patience, concentration, are all signals that, something maybe be going on with them.
Mm-hmm. Or emotional ups and downs, where a kid who had been a sunny kid before suddenly punches everybody, and those are signals that are difficult to miss.
That's true, and it also goes in the opposite way. A withdrawn child can also suddenly become the class clown, and become almost an extrovert. You might think, well, gee, that seems like in an odd sort of way a good thing, but that great change in behavior could be to overcompensate for certain feelings and insecurities they have.
Yeah, I agree, and again, that's a heads up for parents.
Dr. Beth, as long as you're quoting a study, I thought I might. It reminded me of another more recent one.
Please.
Okay. I don't have the particular citation, but it was there was an article written by the researcher or about the research a few months ago, I believe, in the New York Times Magazine, describing the changing criteria by which people seek a spouse. And I think that one of the things that really the research showed, I think they compared like maybe the 1970s to today. Many of the criteria that were used before to choose a mate, or at least that men considered to be important, were besides the typical initial attraction and so forth, but it also includes certain long-range kinds of qualities in a person, whether including, for example, will they be a good parent? Should they wish to have children? Are they patient and so forth? Things that are more long-lasting, as opposed to in more recent times, those have not really mattered nearly as much. Whether it was fidelity, past relationships, future parenthood, these all seem to have declined tremendously in terms of young people's choice of a mate. And certainly much more short-term, more temporary qualities have been selected out, such as does she laugh at my jokes, a sense of humor, how smart is she? I'm sorry that this is a one-way thing. The study was of men, actually.
Okay.
But in any case, I think that because people are making decisions based on very fleeting and temporary criteria, it just goes to figure that many of those decisions are not going to be good ones and may end ultimately in a divorce. And so I think the good news is that, people today who, in the face of a 50% divorce rate, I think for people to feel, more confident in their decisions, it would be to make sure that they discuss these long-term kinds of values and wishes for their lives. Many of them may have never thought of it even for themselves, but having that discussion would certainly, make them begin to think about it, and would be more likely to come to a decision that will last in a happy marriage, even in the face of everything else that's going on, even in the face of their own parents' divorce and so forth.
That's interesting, because I personally don't know if I agree with you that wanting someone who's smart and who laughs at your jokes are fleeting, because I think that having a sense of humor is what gets people through tough spots in their relationship.
I think that is a good qualification, and I think you're right. I think a sense of humor, you're absolutely right. Perhaps what would be more indicative would be appearance, for example.
Yes.
Obviously, appearance is completely temporary, so making decisions that involve appearance certainly would, lead to a decision that is not really going to work after too long.
Right. Yeah. And because, as you say, appearance is completely temporary. Men lose their hair, get pot bellies. Women, women put on weight when they have children that's difficult to take off, etc. So, But I think the larger point that you're making is that culturally, what people seek in a mate changes. The choice of beauty in the 1960s was someone who was buxom, like Marilyn Monroe. Now, women can't be any bigger than a size 6 or they're discarded. So be on the lookout for more temporary and I would say superficial attributes when you're seeking a mate. So some takeaways from my audience is I know that the comments I have made about parents' divorce and family of origin issues may seem like I blame adults for their children's struggles. I do not. And neither does Dr. Brodsky, from what I can discern. But rather, it's to help people understand why their mind runs on the track that it does. That's not to say they can't reroute the train either, to follow this metaphor. But it does help when you have a map. Dr. Brodsky, thank you so much for spending some time with me today. I hope this has been thought-provoking and informative for my listeners, because, of course, whom you marry is a very important decision. So thank you.
Thank you very much, Dr. Beth. It was a pleasure being here with you.
Oh, good. Me too, me too. Coming up next week, folks, I will be talking with Pamela Madsen, the author of a book that she's written called Shameless. The subtitle is, I love this, How I Ditched the Diet, Got Naked, Found True Pleasure, and Somehow Got Home in Time to Cook Dinner. She's kind of funny. So that'll be an interesting conversation. And I'll also be talking with Steve Piacenti, the author of a book on the first black congressman in the U.S. Congress. So come on back and see me next week. I'll be looking for you. In the meantime, have a good week. This is Dr. Beth Erickson, host of Relationships 101 on webtalkradio.net. Bye-bye.